Nearly $2 billion gone overnight. No warning, no transition, just termination letters. That is not exaggeration. Late last night, the Substance Abuse and Mental Health Services Administration sent hundreds of letters canceling federal mental health and addiction grants effective immediately. Programs across the country were told that as of yesterday, that the funding keeping their doors open no longer exists. Street level mental health care, overdose prevention, peer recovery services. Some providers are being told they may have to shut down tomorrow. According to NPR, the total cuts could approach $2 billion. One national recovery organization alone lost about $500,000 overnight. No phase out, no safety net. And this is the part that matters. These grants sit on top of Medicaid funding. Medicaid was already cut last year by a Republican-controlled Congress. So
That was the big, beautiful bill that Medicare was cut last year. That's what she was referring to.
This is not a single decision. This is a coordinated dismantling. As a nurse, I really need you to understand what this actually means. It means overdoses that would have been reversed will not be. It means people in crisis will end up in ERs, jails, or body bags. And it means the safety net did not fail. It was cut on purpose. The letters say these programs no longer align with the priorities of the Donald Trump administration. Overdose deaths were declining. These programs were working. This is not fiscal responsibility. This is policy with a body count. Elections have consequences. Budgets have casualties. And this one will be measured in life. What happens when profit comes before patient care? Congress is about to cut off the money completely. New bill introduced this week on March 23rd by Senator Chris Murphy and Representative Mary Gay Scallion would ban Medicare funding for nursing homes and hospitals owned by private equity firms. Let me actually translate what that actually means. If this passes, those facilities lose access to Medicare reimbursement, which is basically their financial lifeline. That's not a penalty. That is a shutdown risk. So now here's the part.
I warned about this. A lot of facilities are going to get shut down because they don't have any more money. Because a majority of them, I'd say 80% of these facilities have been relying on, depending on Medicare. Now the government is broke. And this is going to affect you as a caregiver, as a nurse, or anybody that worked for any of these facilities that depended on money from the government. You're going to be out of work.
People are not paying attention to. Private equity firms only own about 5% of nursing homes in the United States. So this bill is targeting a relatively small portion of facilities, but lawmakers argue those facilities are causing outsized harm.
I'm willing to bet some of you are working for these nursing homes that are owned by these private equity firms.
Because data shows that after private equity takes over, facilities often cut staffing, reduce services, and increase cost.
This is where you're impacted. Okay, where they cut you overnight, no warning. It's coming.
While outcomes get worse. One of the most alarming claims tied to this bill, elderly patients in private equity-owned nursing homes have an 11% higher mortality rate. So from a nursing perspective, that tracks with what we already see. When staffing gets cut, your nurse to patient ratios go up. When supplies get limited, you start delaying care. And when profit becomes the priority, patient safety becomes negotiable. And let's be very clear about something.
Unfortunately, in this economy, profit is number one priority. They don't care about you as a worker. They don't care about the patient. It comes down to the bottom line, the dollar. We're in late stage capitalism, and it's very cold.
Long-term care is not a casual business. You are dealing with medically fragile, often cognitively impaired patients who rely entirely on staff to survive. So this isn't just about business models. This is about whether the system is structurally set up to fail patients. So now the pushback, Industry groups are saying private equity ownership is limited, and the real issue is chronic Medicaid underfunding and a growing caregiver shortage. And honestly, that's not wrong either. So now we're left with the real question: is private equity the problem, or is it exposing a system that was already broken? Either way, if Medicare funding gets cut, this isn't theoretical anymore. Facilities will close, patients will be displaced, and clinicians will be left managing the fallout.
Which is you have to manage the fallout. So if you don't want to deal with any of that mess, this is the time to start your own home care business. But you got to do it the right way, okay? Now in 2026, there's technology that will allow for you to be able to do it 10 times faster and more efficiently. AI is here now. So there's certain tools that you can use like Claude Cowork that can be the back end. It can do your accounting, your HR on the back end, and all these caregivers you're going to hire, they need to start working for private paying clients. So this is where you're going to need a coach. So when you work with me and invest in yourself, I'll teach you how to do two things. Number one, you need to learn how to do sales. So you learn how to articulate your value to the marketplace, specifically to wealthy clients. Convince those wealthy clients to do business with you. Number two skill I'm going to teach you how to do is to market your home care business. You're going to need to know how to brand your home care the right way so you can attract these wealthy clients. So if you're ready to work with the best, schedule a call, invest in yourself. I'll add you to a private membership group. There's already a bunch of other people that are starting their home care business that are serious about doing the work. We can hold each other accountable to do the work. Schedule a call, invest in yourself. Talk to you soon.